Hi guys, it's Dr. Morgan here again, and I empower women throughout their pregnancy. This is Facebook Live number 2. Hopefully I am not upside or not on the side, and I'm right side up. So you can go ahead and comment on there if you're watching and let me know if you can see me good. Anyway, today I want to talk about birth plans. So obviously birth plans are thought of as a good thing, and most people tell somebody when they're pregnant to make sure that you have your birth plan in hand, ready to give to your healthcare provider. And I'm going to go ahead and tell you to stop planning your birth. And instead of planning your birth, we should start talking about our birth preferences. See, it's different planning a birth and talking about birth preferences. Right now, if you were to get on Google and type in, say you just became pregnant, or you're going to become pregnant in the future, or that's part of the plan, and you get on the computer, get on Google, and you type in birth plan, something like this will pop up. If you can see that. So it says birth plan. There's a lot of little boxes and a lot of little things that you just check, right? It might ask about positioning. It might ask about healthcare providers. It might ask about what you want to happen right after the birth, which is good to start thinking about this stuff. But before you even pick up, or before you get onto Google and type in birth plan, it's way more important to start thinking about your birth preferences. And that starts with one question, actually a couple questions, but you should be asking yourself what your philosophy is when it comes to birth. See, whether we know it or not, all the decisions that we make in life, whether it's the city that we want to live in, the partner that we want to be with, the job that we want to have, it's all based on our philosophy. And birth is an awesome thing to start thinking about what your philosophy is. Do you view birth as something that's natural and you came from generations of women that birthed at home? Do you view birth as a medical procedure? Do you personally have a lot of fear around birth? Do you feel excited about birth? What is your philosophy when it comes to birth? And more importantly, asking that question to your healthcare provider. What is their philosophy on birth? What's your partner's philosophy on birth? From there, you can start a conversation, and when we know what our philosophy is and we can feel rooted in that, then we can start making better decisions, because those decisions will be based on that philosophy, and we can start putting together a team of people that you will feel supported by, because they will know where you're coming from with your preferences. So it's super important to think of what your birth philosophy is. Another important question that you can't answer filling out a checklist is, what do you want your birth to be like? What do you want your birth to feel like? You can go, you can check these little checklists, and it might incorporate some things of who you want in the room with you, or what type of environment you want to be in. But more importantly, stuff that you cannot just write down on a checklist is, what do you want it to feel like? I ask this to a lot of women in my office, and most of them don't have an answer right off the bat because they've never been asked that question. They've been asked about, what do you prefer with this? What's your plan for this? How do you feel about this? But more importantly, what do you want your birth to feel like? So again, I think it's important that we stop planning so much, maybe in life in general, stop planning so much and start thinking about what our preferences are. Because when we have preferences and we come from a grounded philosophy, then we're able to make decisions where we feel supported, and more importantly, put together that team where we feel supported. Because what I know is that women remember their birth experience. And it could be an awesome, awesome experience, and one that you remember and you hold sacred. And also sometimes some women might view their birth experience or remember their birth experience as a not so awesome experience. And that's okay. That's just how it is. But my goal is to give you some information so that you can look back on this birth experience and feel like you were supported and feel like you were listened to. So if you guys have any questions, or you have any comments, or your moms out there that are watching, if you guys have anything to share, please write it in the comments so that we can all start learning from each other. And if there's any topics that you want me to cover, please comment on there or send me a message. And also share these videos. Whether you had kids 20 years ago, but you like this message, there's people that I'm sure, that are getting ready to start families or are pregnant right now. So continue to share these videos. Let's get these messages of empowerment out so that we can start bringing more empowered kids into this world. All right, thanks guys.